Friends, this is direct jaw. Introduce the tip of the phaco handpiece. Remove some superficial cortical matter. Now turn the handpiece. Make the bevel up. Now introduce the chopper. This is a very small chopper. Push the nucleus little down. Embed the tip of the phaco handpiece into the substance of the nucleus. Hold the nucleus very firmly now with high vacuum. From position 3, come back to position 2. Now use the chopper, bring it towards the tip and separate the nucleus like this. Rotate the nucleus, hold at another place and chop it like this. This nucleus is brittle and it is getting chopped very easily. There may be some cases where the fibers are leathery and it will not chop so easily. After chopping the nucleus into several fragments, emulsify each fragment with ultrasonic energy and remove it. In this case, phaco power used was 65%, flow rate was 45 ml per minute, vacuum is 450 mm of mercury. The machine being used is Oatley Catarix 3. During the last few bits of the nucleus, be very careful. The chamber should be very much stable. There should not be any surge. And go to 3, come back to 2. And in this way, you chop the nucleus. That's it. Now, there's a small bit of nucleus just in front of the side port. Yes. It comes to the tip, be at the center and emulsify it. Be very slow and your hand should be rock steady. And now, in this case, I'm going to use Bimanual I. What I do is I'm irrigating for something like hydrodissection to loosen the cortex. Now use the irrigation through the right side port and aspiration goes through the left side port, and most of the cortex is removed in no time. Now change hands. Now irrigation is through the left side port, aspiration through the right side port. Now see what happens. Here I have caught the posterior capsule, and if I pull it, I'll cause zonular dialysis. So I have to release in time and very gently I have to clean the cortex tangentially. Viscoelastic substance is injected now, and in this case a foldable intraocular lens is being implanted using viscoelastic substance. Now, since the zonular dialysis or zonular tear is at 12 o'clock, one haptic is placed at 12 o'clock so that this area gets some support. Now, viscoelastic substance is thoroughly cleaned using Simcoe cannula and this irrigating probe of Bimanual IA. Then irrigation and aspiration is used simultaneously. Thorough removal of viscoelastic substance is a must. Otherwise, the patient will have high intraocular pressure during night. The patient will not be able to sleep. Patient may develop steamy corneal edema because of high intraocular pressure. And most importantly, you will not feel happy next day listening to patient's complaints. So clean the viscoelastic substance nicely so that IOP doesn't rise. And then close the side ports by hydrating the stroma. This is the final lavage of the anterior chamber, and the anterior chamber is formed nicely and the case is concluded. Thank you very much for watching. Hope this video will help you in developing your surgical skills. Be better, do better.